Good evening, ladies and gentlemen, and thank you all for joining us today for this webinar titled Breaking Mental Health Stigmas. I'm Christine, your host for this event, and we are honored to have each of you here united in our commitment to address mental health stigmas head-on. Today, we will explore the impact of these stigmas on individuals and society and discover strategies to challenge and break them. Before we begin, I just wanted all of you to know this webinar will be recorded and the whole proceeding will be uploaded on YouTube. And there's a surprise gift for all of you, which will be given at the end of this webinar. If you want that gift, please do stay on till the end. Let's start by acknowledging the importance of this topic. Mental health stigmas can hinder individuals from seeking help, perpetuate misconceptions, and create barriers to progress. Our mission today is to foster understanding, empathy, and positive change. Throughout the webinar, we will encourage active participation to feel free to ask. So do feel free to ask questions during the question and answer session. Without any further delay, let me invite our speaker, the eminent Mr. Chirita Patra, who is an author of 5 books, a life coach, and a motivational counselor. Mr. Patra, the mic is all yours.
Thank you, Christine, for this sweet and crisp introduction of me. Good evening, everyone. I'm truly excited to meet you all in this most awaited event that I organized a month ago. Tonight among us, we have teachers, students, a digital entrepreneur, doctors, people from the NGO sector, a special educator, a clergy, a housewife, freelance writers, consultants, a journalist, a manager, and a fitness trainer. Yeah, all of them haven't joined till now, but I'm sure they will join soon. I'm really delighted to see people from different fields. Why? Because whatever you learn here tonight, you will pass it on. Pass it on to your colleagues, friends, and family members. That's the core objective of this webinar. While setting the invitation for the webinar, I kept an option to know the expectations of all the participants. And their responses truly made me very happy. Most of them wanted to know, learn, and gain insights about mental health and the stigmas associated with it. Some wanted to protect and safeguard their own mental states, and they expect that this webinar will help them achieve that. Some have also expressed the desire to learn about ways to handle mental health or benefit out of it. Tonight, we will only talk about the stigmas associated with mental health and how to break them down. I think that's the first and foremost step for taking care of our and others' mental health. Christine, is it possible for you to accept whoever admit or whoever is joining?
Yes, I'm doing that. I'm doing that.
Yeah, please do that because that distracts me.
I'm on it. Yeah.
Okay. But the very first question comes to my mind: why this subject is so important, especially in recent times? I want to present a few statistics that will be an eye-opener for all of you. 1 in 5 individuals suffers from mental health symptoms. 50% of conditions begin by age 14, 75% by age 24. 60 to 70 million suffer from mental disorders. India has 2.6 lakh annual suicide cases with a rate of 10.9 per lakh people, according to WHO. This is the recent article that I read, and that's why it's 2.6 lakhs, it says, because in 2021 it was 1 lakh something, the suicide cases. Another statistic says that about 8 lakh people die by suicide worldwide every year. 1,64,033 Indians committed suicide in 2021, according to Wikipedia. The WHO says about 20% of Indians would suffer from mental diseases by the end of 2022. That year is gone, which means maybe 20% of Indians are already suffering, or some are suffering. We do not know. Maybe more than that. There is one article in Times of India. It says, according to the World Health Organization, 5.6 crore Indians suffer from depression and 3.8 crore from anxiety disorders. A research published in the Lancet in October 2021 found a 35% increase in mental health disorders in India. In India, you saw all these statistics, staggering and very alarming for Indian citizens, okay, for Indian people. But sadly, in India, more than 80% of people do not seek professional psychiatric assistance. They do not even go to any counselors. Forget about psychiatrist. You will hear personal accounts of shame, misery, prejudice, and embarrassment from people you know who have experienced these things. It's alarming, isn't it? This is the first reason why we need to discuss on this subject. What's the second reason then? We all know in 2029, the onset of pandemic literally upside the condition of this world. Everything. The COVID-19 pandemic worsened India's already poor mental health statistics. The first wave, which swept the world in 2020, intensified the situation due to various factors. Number 1, long periods of isolation. Number 2, frontline workers unable to be physically close to their families. Number 3, job losses and financial difficulties. Number 4, inability to see or meet loved ones. Yeah, all these things actually give rise to mental issues. I lost my father in 2020. He didn't die of the corona, but he died probably inability to see and meet his loved ones. Even I couldn't, because I was sick and my mom was with me. And my sister was, the youngest sister was with my father. And I lost him. Many have lost them. Many have lost their loved ones. Escalating alcohol and substance abuse due to stress. That's another reason. Fear of the unknown and uncertainty. Constant worry about infection and spreading it to others. I was also very scared because I have cardiac issues from birth. Those who know me, they understand it. I was very vulnerable to coronavirus. I was also very anxious during those times. Difficulty in expressing oneself, working overtime and disrupted work-life balance, loss of loved ones to the infection, surge in domestic violence cases. Everybody stayed at home and domestic violence cases of domestic violence increased. Closure of institutions. Many job and institutions were closed down. And all these 12 points caused Indians to suffer mentally. These circumstances, along with others, intensified the critical situation of unaddressed mental health issues of India. Now, I'm sure all of you are convinced why we need to discuss mental health issues. Let's discuss them. What does mental health stigmas mean? Stigma refers to the negative attitudes, beliefs, stereotypes, and prejudices that are associated with a particular characteristics or trait. Mental health stigmas refer to the negative attitudes, beliefs, and stereotypes associated with the mental illness and individuals experiencing mental health challenges. These stigmas often result in the marginalization, discrimination, and exclusion of people with mental health conditions from the various aspects of society. Before I proceed, let me just ask the audience, am I audible to all of you? You can send a emoji, thumbs emoji. Okay, yeah. Thank you so much. Yeah, probably those who are unable to hear me, it's because of your connection issue. Please try to reconnect. Thank you so much. Next, I want to present to you the historical context and societal implications of mental health stigmas. Let's see what the history says about it. Throughout history, mental health stigmas have been prevalent in many societies. In the past, mental illnesses were often misunderstood and associated with supernatural or demonic causes. Bhutia. Everybody, they used to think this is ye sab bhutia kaand hai. Probably the person who is suffering with mental issues is demon possessed. They used to think. Probably in many villages, they are still thinking that way. They call the sorcerer, they call that a person to drive out the demons. This led to the isolation and mistreatment of individuals with mental health conditions. In the 18th and 19th centuries, as societies began to understand mental illness as medical conditions, specialist institutions known as psychiatric institutions or mental asylums were established to house and treat individuals with mental disorders. While the intentions behind these institutions were to provide care and treatment, they had significant negative consequences like institutionalization and social isolation. Sadly, ये सब institution create किया गया है, found किया गया just to treat those who are suffering. लेकिन हम लोग टैग कर दिया ये पागल है करके. And that literally isolated these people from the mass, from the general crowd. How sad it is. Here are some more key points about mental health stigmas and their impacts on individually and socially. Number one, delayed or avoided treatment. People may avoid seeking help or treatment due to fear of judgment and discrimination. This avoidance can lead to worsened mental health conditions and difficulties in managing them effectively. Number two, social isolation and loneliness. Stigmatization often leads to social exclusion, causing individuals with mental health conditions to feel lonely and alienated, as friends, family, and colleagues may distance themselves due to misunderstanding or fears. Reduced quality of life. When somebody is suffering and people are isolating, and because of stigma, a person feels really, really low. He or she does not feel any joy in his her life. Employment discrimination. At workplace also, people were discriminated, those who were suffering with mental illness. Limited access to healthcare. Lack of understanding about mental health and conditions may prevent communities and policymakers from prioritizing mental health resources and funding, thus hindering access to mental health services. Suppose if I have to explain it, suppose in a city, there is no awareness about mental health issues. Only we have health institutions or medical facilities for physical health. You can imagine those who are suffering, they have no place to go in that same city. There is no medical facilities. Impact on relationships. Number 6, stigmas can strain relationships with family members, friends, and partners, leading to misunderstandings, conflicts, and strained communication. Self-stigma. Internalized stigmas may lead individuals to feel ashamed or guilty about their own condition, further aggravating mental health issues and discouraging them from seeking help. I have seen that. I have seen that in my family as well, and among my friends. Underreporting and misdiagnosis. No, there is one person. I asked him to go to a counselor or show to a psychiatrist, and he said, "Am I mad? Have I gone mad or crazy?" That was the mindset. It's self stigma. Because of self stigma, she or he, whoever it is, they don't go out to seek help. Even they underreport their symptoms. What the doctor will think, what the family member will think who has come with me. So they underreport their symptoms. Impact on minority groups. Some communities and minority groups may face additional stigmas related to cultural beliefs, making it even harder for them to access mental health support and resources. Now, we will move on to a very important segment of this webinar: common misconceptions and stereotypes. Please pay attention. What is misconception? Misconceptions refer to beliefs or understanding that are not accurate or are based on incorrect information. These beliefs can be widespread and accepted as true by a group of people or society. I mean, whether it is true or not, it is accepted by the society or a group of people. Okay, they just accept it. I will give you examples. Misconceptions often arise due to lack of knowledge,
Is it a boy?
misinformation, or the influence of cultural or social factors. Correcting misconceptions is essential for promoting accurate understanding and making informed decisions in various fields, including science, education, and social issues. What is stereotype? It is tagging, naming, or labeling. A widely held but fixed and oversimplified image or idea of a particular type of person or thing. That's the Wikipedia. That's the online dictionary defines stereotype. The example is the stereotype of the woman as the caregiver, whereas even a man can be a caregiver as well. Another example is women only suffer with mental illness. That's another stereotype. But the statistics say in 2021, the male to female ratio of suicide victims was 72.5 to 27.4, while 70 is to 30 in 2020. So in 100, 72 people, 72 males committed suicide, and 28 females committed suicide out of 100. The number of male suicide was 118,000, whereas female suicide accounted for 45,000. So what should we conclude? Women only suffer with mental issues is a misconception and stereotype, because the reality is men suffer more in India in regards to mental health issues. Women express more. That is why we could know men don't, for the fear of stigma. They will lose their machoism. What will my friend will say? What will my friend say? I won't be manly anymore if I say that I have mental issues. Let's get into the details. What are the misconceptions? Number one, mental health conditions are not real illness. They are just a sign of weakness or lack of character. This misconception suggests that mental health problems are merely a result of personal flaws or weakness rather than legitimate medical conditions with biological and psychological underpinnings. Number two, people with mental health issues are crazy or insane. We have already discussed about it. Number three, only mentally unstable individuals seek therapy or counseling. This stereotypes assumes that only those who are severely unwell or unstable seek therapy, disregarding the fact that therapy can benefit everyone, because we all, at least after pandemic, we all have suffered mentally some other way. The degree may be different, but we all need little inspiration, little counseling, little comfort from each other. It may not be medical professional, but we need to talk about how I am feeling, not just to ignore how I feel. Mental health conditions, number four, mental health conditions are just a phase that people will eventually grow out of. This misconception dismisses the long-term impact of mental health issues, suggesting that they are temporary and will naturally resolve over time. Some issues, most of the mental issues don't go away unless they're addressed and treated. Number five, children and adolescents cannot have mental health problems. It's just a part of growing up. This stereotype minimizes the significance of mental health challenges in young people, children, and may prevent early intervention and support. Have you heard of childhood traumas and childhood mental issues? Because when they were small, when they were kids, they were not addressed. Their mental health was not addressed. That is why they suffer in the later stage. I remember, I will give my example. Those who don't know me, let me tell you, I'm a cardiac patient from my birth, by birth, and I had many restrictions. Physical restrictions. In school, I used to stand in a corner and watch my friends playing cricket or football. I'm unable to do that. And every time I come home, I used to ask God to take my life away. And or I used to question, why did you create me like this? But I did not know that I am suffering from some mental issues, because it prolonged for a long time. I know that feeling was there. I was very restless. Sometimes I feel restless. In the evening time, I used to feel restless. As I was preparing this document, as I was preparing, when I started being a life coach and counselor, I understood, I just recalled my past, and I just reminded of how I was feeling. And in 80s, I was talking about 80s, and I had no awareness, even in the family, even in the whole country. Like we are in like 2023. I am talking about 1980, 85 to 92, my schooling. And that period of time, there was no awareness about mental, I don't know, at least. I did not know that I'm suffering. But now I recall that I was suffering. I don't know how I came out. God's grace and the comfort of people around me. And I was good at my education. So, and my interest in literature and writing, that helped me to come out of it. But everybody doesn't get that particular, those conducive environment. Everybody doesn't get that. So we need to know, we need to take this misconception out that only adults can have mental issues. No, children and teens, they can also face severe mental issues. Number 6, seeking help for mental health issues is a sign of failure and inability to handle life challenges. This misconception discourages individuals from seeking help, as they may fear being perceived as a weak or incapable. Number 7, medication is the only solution for managing mental health conditions. This oversimplification suggests that medication is the sole or primary treatment for mental health conditions. No, even in through counseling, mental conditions can be healed. Number 8, people with mental health issues are violent and dangerous. No, that's a misconception. Number 9, mental health conditions are caused by bad parenting and traumatic experiences. We could have accused parents in the past only. Now, children go out, parents don't even see them for hours together. There are many distractions. The stressors in the past were maybe only job, family, and some family financial pressure. Okay, only 3 or 4 stressors. But now, now if you count on the stressors, it will be staggering amount. Maybe 16 to 20 distractions and stressors. So it's very natural for people to have mental health issues. Parents are not solely responsible for mental illness. You can always tell if someone has a mental health condition just by looking at them. No, not at all. You cannot. I always smile. How will you know that I have a problem inside me? You cannot. There are people who are those who are introverts, but they don't suffer mental illness. But some extroverts, they suffer mental illness. You won't be able to know. Just because they're mingling with people, we can't say that they aren't suffering from mental issues. Mental health issues are not as severe as physical health problems. Oh, come on. Mental health problems can also take lives. What about suicide? Forget about suicide. Apart from suicide, it can also take your life. Number 13, mental health conditions are a result of personal choices or lifestyle. No. This misconception disregards the complex nature of mental health issues and can lead to victim blaming. Number 14, people with mental health issues should just snap out of it and be more positive. That's easy to say. But those who are suffering, I have suffered, I know. I have come out of it by God's strength, by the comfort of people around me. I know how difficult it is.
Sammy, come here, please.
Individuals with mental health conditions are unable to maintain stable relationships. No, they can. There are mental health, there are many people who suffer from mental issues, yet they can have fulfilling marriage life, marital life, and other relationships as well. Individuals with mental health conditions are a punishment for past wrongdoings. That's wrong. 17, mental health issues are contagious or can be caught from others. No, it is not. This misconception has no basis in reality and contributes to fear and discrimination against those with mental health conditions. Number 18, only weak-minded individuals experience anxiety or depression. Number 19, mental health conditions are a rare occurrence. This misconception underestimates the prevalence of mental health challenges, leading to a lack of attention and support for those affected. It's very common these days, mental health issue. It's not a rare occurrence. And the last one, individuals with mental health issues are unfit for employment and cannot be productive members of society. That's rubbish. This stereotype overlooks the many individuals with mental health conditions who lead successful careers and contribute significantly to society. Challenging these misconceptions and stereotypes is essential for creating a more empathetic and supportive environment for those experiencing mental health challenges. Now, there is a segment which titles as impact of personal stories and breaking the silence. And this is breaking the silence. This is one of the attempts to break the silence and speak out. If I ask someone, will you unmute and speak how you are stigmatized, or how you faced stigmas and misconceptions in your life? Anybody? For others' encouragement, remember that this is recording. This is being recorded and it will be uploaded in YouTube. So considering that, if you want to come out without switching on your video, if you want to share in one line, Not much. Not one line, 1 minute. Anyone? I have spoken about myself. The question is, do you have any personal stories of stigmatization? Are you suffering? Are you suffering or have suffered in the past with mental illness? And have you faced these stigmas or misconceptions from people around you? Or you have self-stigma? We want.
Yes, I did. I did have a terrible. I did undergo depression when my husband died in Delta COVID, and I went through a lot of challenges when he died. We didn't expect that he would pass away, and I was also in ICU at that time. I could not attend the funeral. And I stayed back in the ICU for 10 days, and I returned home as a widow. That was a terrible, terrible experience I had, and a lot of challenges, many things about financial issues to be settled and many matters to be settled. It was not easy, but I have come out of it almost slowly, uh, though sometimes the memories are there, it comes up.
So have you faced any stigma from people around you, or you got comfort and consolation from all others?
Yes, stigma in the sense the what the people have told me that is hurtful. Some of my husband's siblings, they didn't even call me because they didn't visit me because it was a Delta COVID. No one went out of the house, but I didn't even receive phone calls. After 2 months, I took the initiative to call his siblings, and one of them said, we are also going through grief. I really wanted to tell that you are going through grief, but none of you became a widow. I only became a widow. My situation is widowhood. You all might have only lost your brother. So I wanted to tell that, but I thought if I had told, they would get hurt. I just kept it in my heart. And that still is remaining in my memory, but I have forgiven them.
Yeah, praise God. Thank you so much, ma'am. Thank you so much for sharing your heart. Anyone else? Any other volunteers? If you want to. Are you facing any stigmas if you are suffering with mental issues?
Hello.
Yeah, Kalpana.
Hi, can you hear me?
Yeah.
Yeah, hi. Yes, if there are some background noises, pardon me for that.
Yeah.
I'm a mother to a non-verbal autistic child,
Yeah.
and I live in Belgium, where awareness compared to India is on a large scale. So I never feel that kind of stigmatized pressure when I go out with my. But here, when I come to Delhi, when in India, I somehow pressure of people judging him. The thing you mentioned that meant pagal tag. I feel it all the time. All the times I feel the same. And when I go out with my child with his noise cancellation headgear and some chewy around his neck to calm him down, I see some kind of questioning stares towards my son. So, yeah, though I don't live here, but I feel it would have been quite tough for me as a parent of a child who is having some neurodevelopmental issues.
Yeah.
It would have been quite tough here because lack of awareness and understanding here in India. So
and
that's my struggle.
autism is not even mental health issues. It
It
caused,
is not. It is not.
it causes
Exactly.
mental health issues later stage, but
Yes.
primarily it is not mental health.
Primarily, it is not. Yeah, that's what I'm saying.
Yeah,
Like
yeah.
people can't accept people who are different from them, it seems.
Correct.
And it's not just autism or any other thing.
Yeah, yeah.
I have heard people saying like, अरे ये क्या कर रहा है लड़का आपका? ये क्या ऐसे कैसे?
Yeah. Yeah.
So, yeah.
Thank you so
That's
much,
the thing.
Kalpana. Thank you so much.
Welcome.
Anyone else? One last, if anyone is bold enough to come out. Not bold enough, if you have anything to share. Okay, I think nobody wants to share, but it's okay. Thank you so much for ma'am. I don't know her name, and Kalpana. Thank you so much for sharing your heart. And I would like to say what happens when we share personal stories and break the silence. Number one, the transformative power of personal narratives in mental health advocacy. Personal stories hold incredible strength in challenging mental health stigmas, humanizing the experiences of those with mental health conditions. By sharing their stories, individuals defy stereotypes, foster empathy, and promote understanding. These narratives create a window into real life struggles, breaking down misconceptions and nurturing a more compassionate perspective. You know, after ma'am shared and Kalpana shared about her experience, and many of us, as we if we can share our personal stories with each other, we will be encouraged, we will be comforted, we will know that we all go through some kind of mental issues. If not, at least as I said, 1 out of 5%, the statistics say 1 out of 5% persons suffer with mental issues in India. Shattering shame, embracing support. This is the number 2 benefit of personal stories and breaking the silence. Sharing lived experiences of mental health challenges reduces shame and encourages seeking help. Brave individuals deliver a powerful message of solidarity and courage, inspiring others to open up. Yeah, I would consider both Kalpana and my friend and ma'am, who have a very brave, they deliver a powerful message to all of us. Embracing, I'm not I'm not tagging all others as weak. I'm just sharing. Okay. Embracing vulnerability for a stigma-free world. That's necessary. Personal narratives demand vulnerability. We need to accept vulnerability. That's there. We are weak at so many point of time. Accept it. Share it. Challenging the norms that perpetuate stigmas. By sharing their journeys, individuals pave the way for open dialogue, eradicating fear and reducing the stigma surrounding mental health, spreading hope and forging bonds, empowerment through personal narratives, dispelling myths and misconceptions, and role of education, media, and engagement. This is the last section of this particular section. Then we will move to the question answer session. Accurate information and education play a vital role in combating mental health stigmas and promoting understanding.
I think in
Yes.
school, at school level, it must begin at school level.
Okay.
You know, if like, as you mentioned, like even kids can have mental issues, illnesses,
Yeah.
and to address
I'm
at the
coming to that.
grassroots level is very important.
Yeah, I'm coming to that.
Yeah.
Mm,
Because
yeah, Kalpana, I'm coming to that.
yeah,
It is crucial to provide accurate and evidence-based information about mental health conditions, their causes, symptoms, and available treatments. Misinformation can perpetuate myths and misconceptions, further contributing to stigmatizing attitudes. Accurate information empowers individuals to make informed decisions, seek appropriate help, and support others in their mental health journeys. The role of schools in mental health education and support. That's what Kalpana was mentioning. Schools can play a crucial role in promoting mental health literacy, awareness, and help seeking among students, staff, and families. Schools can also provide or facilitate access to mental health services for those who need them, such as counseling, peer support, or referrals. All we hear about teachers beating the students and bullying by peers. Yeah, in some schools, they have started counseling in schools. My sister-in-law, who is a teacher, I was asking her when I was preparing this one. I asked her, does your school have? I mean, does the textbooks talk about mental health as it talks about physical health and physical illness and cardiac problems and this issue, that issue? Does any science book talk about mental health? She said no. So it should come in the textbook as well. Media influence on public perception and attitudes. Media can have a significant impact on how people perceive and understand mental health issues, as well as how they relate to people with mental health problems. I was looking for movies on mental health issues. No, Tare Zamin Par is about dyslexia. That is that's not mental issue. That's learning disability. And autism in My Name is Khan is again primarily it's not mental health issues. And all media portrays about mental health issues as psychos, psycho killers, criminals, right? This is what media does. There is no talk shows, very rare. Either they are ignored by us, viewers. If it is shown as movies, then probably we can watch. Now we have more scope on after this pandemic, OTT platforms. We have more scope. Okay. Responsible media practices for accurate representation. That is also necessary. Media professionals have a responsibility to adhere to ethical and evidence-based standards when covering or creating content related to mental health. I will ask Avinash, I will ask. There is a question answer stage. We will talk about that. I will give you the podium so that you can ask questions. Engaging the community through awareness events and forums. There are no forums. I have seen in Western, if you have if you have seen in Hollywood movies, they sit around each other. Okay, they just sit in a circle and discuss about their problems. It's a closed group. They take vow that we are not going to share anything about anybody outside. It will stay here. We will just share and encourage each other. I don't think we have in India. We should have community, engaging the community through awareness events and forums. Yeah, this is an awareness events. One of the events. There are many events, webinars are coming up these days. Collaboration between different stakeholders for collective impact. Collaboration involves working together with different sectors and organizations that have a stake or interest in mental health issues. That's important. Empowering individuals and communities to challenge stigmas. Empowerment involves supporting individuals and communities to have a voice and agency in matters that affect their mental health and well-being. This can help to reduce stigma by enhancing self-esteem, self-advocacy, and social action among people with mental health problems. Yeah, Avinash, you wanted to add something or you have a question?
Yeah, I have also, I want to add something, and I have also, you can take it as a question.
Okay.
Because I remember the hype of this mental health issues was there during 2000, during the second wave of COVID, especially, and somehow I was able to address this issue. But later on, when I saw that we need to continue working on this thing, but sadly, those who were there elder to me in my team, they said no, it's all gone because now COVID is no more there, so there is no more mental health issues. But when I look at the statistics, it is going up and up every
It's
time.
going up and up.
So
Yeah.
that is there. And
Yes.
secondly, I would say it's all about our own people's thinking and ideology.
Yeah.
And
Yeah.
alongside in India, we especially in concern to men. So the men who are here, they can agree with me. They can relate to this thing that we have been brought up with a very culture, like machism. We are the macho man, and nothing
I
can
think
hurt us.
Avinash, you joined later, so you did not hear all these things. Actually, I addressed this
Yeah.
one. Yeah.
So
We
that
think that
is,
we will lose our manliness by sharing our heart, but we
yeah,
suffer more. The suicide ratio
yes,
in India is 72:28, male and female.
yes,
Out of
yes.
172 committed suicide are males.
Males.
Okay, so we
So
suffer more, but
mm,
we don't
mm,
share because of this stigma. We will
yeah.
lose our machoism.
Even
Okay.
in family also, we have been brought up in that way
Yeah,
that
yeah.
we should not
You are
share.
right. You are right.
So sadly, that's a painful stuff, and we
Yeah.
need to address this issue.
Yeah. Thank you so much. Thank you so much for speaking out. Over to Christine.
Wow, that was indeed very enriching. Thank you, Mr. Patra, for that enlightening keynote address and all the details pertaining to mental health and the stigmas associated with it. And now it's time for an engaging panel discussion with our esteemed guests and Mr. Patra. I will ask Mr. Patra to introduce the guests as they will share more about the effective strategies in order to face mental health stigmas on personal, societal, and the systematic level. Mr. Patra, the mic is all yours.
Yeah. I will keep this in gallery mode because I don't know how to, probably if I pin our guests. Okay. Yeah, this is better. It's a delight and a privilege for me to introduce two of my very good friends, Dr. Samira and her husband, Dr. K.N. Sukumar. They are both experts in naturopathy and yoga, with Dr. Samira also holding a postgraduate degree in wellness management. Most importantly, they are both psychologists. Both are psychologists, bringing with them over 20 years of experience in these fields. Over 20 years. I am grateful to both of them for accepting my invitation despite their busy schedules. They don't take my calls or see my messages as well. Now she's laughing. And joining me on the panel tonight. Thank you so much, Dr. Sukumar. You gave time and you joined first before your wife joined this one. I just wanted to give a little background about how we met each other. In 2003, when I enrolled for post-graduation degree correspondence course on counseling and psychotherapy, even Dr. Samira was in Calcutta. I was in Calcutta. Both of them were in Calcutta. We were all single individuals then. That time we enrolled, and during the exams, because correspondence course, we won't be able to meet our students. Only I got to know Samira during our exams, and we became friends. And then I went to their hospital in Kolkata, and I met Dr. Sukumar as well, a very jovial man and very hardworking, both of them. And since then, it's already 20 years, right? 2023, 2003. So 20 years. Thank you so much for being my friend. And thank you so much for joining. So I just wanted to give a little introduction to 6 strategies I have laid down to battle stigmas associated with mental health issues. I'm not going to take much time because I want to give the floor little opportunity so that they can ask questions. Number 1 is promoting open conversations about mental health. Okay, I'm not getting into details. I can send all these materials to each of you through your emails. Number 2 is encouraging empathy, understanding, and acceptance. This is very important. Number 3 is combating discrimination and advocating for policy changes. Policy changes. This is not easy. This strategy involves challenging the structural and institutional barriers that prevent people with mental health problems from accessing their rights and opportunities. This can help to reduce stigma by promoting social justice and equality for people with mental health problems. Some examples of advocacy actions are lobbying for legislative reforms. So not a very easy thing. Filing complaints against unfair practices or joining campaigns for better services. Only stakeholders can do all these things. Those who are celebrities, we can only appeal and approach them in our level, ground level. Number 4 is engaging in anti-stigma campaigns and initiatives. This is one of those anti-stigma campaign that I started, and I will be continuing till my death, because I know how I suffered, how I came out. So I have heart and soul for this issue. Number 5 is supporting mental health advocacy organizations. Those who are working for with mental health issues, we need to support them. Creating safe spaces for individuals to share experiences. Like I said, forum. We have seen in Western culture, they come together. I haven't seen in India a small closed places where people will sit together and share each other's troubles. You know, that sharing itself lessens our burden 10% or 20%. So now, before opening the floor to the participants, I have 3 very important questions, which while coaching and counseling, I faced myself, and I want to ask these questions for my to my guests. We all know that if our family bond is strong enough, nothing else can shake us off. However, that's not the case in India regarding the issues concerning mental health. Forget about India, in the world also. Here are my 3 questions. I'm reading out three of my questions. You can answer them together, and then I will open the floor to the audience. My first question is, how can we effectively communicate with family members about the nature of mental health issues and their impact in order to increase understanding and empathy? I have struggled it. I have struggled myself. And when I spoke to people, I mean, the person I'm counseling, when I spoke to their families, they say, what mental health? I gave you all those myths and misconceptions. They also talk similarly like that. Somebody said, Chiradeep, are you serious about these mental health issues? I said, I'm dead sure about it. Okay, number 2 question is, what resources and information can be provided to family members to help them better support and assist their loved one who is suffering from mental health challenges? Number 3 is, what strategies can be employed to address any misconceptions or stigmas that family members may hold about mental health, and how can we foster a more supportive and non-judgmental environment within the family unit? I chose these 3 questions only based on our family, okay? Because if our family is with us, bhaad mein jaye duniya. When our family is not with us, it becomes very difficult. See, I came out of my mental issues probably because my family was a very close knitted and they supported me well. Even if I didn't share about my, because I did not know about it, I shared that. There was no awareness, but it was a close knitted family, and I got warmth, and because of my cardiac problem, I actually got lot of warmth, but that lot of warmth restricted me from doing many things, and that affected my mental health as well. Okay, those restrictions put on me out of love and care caused my some of my mental health, some mental conditions, some negativity it brought, but I overcame. Anyway, so over to you, Dr. Samira and Dr. Sukumar.
Yeah. Am I audible to you?
Yeah,
Chiradeep?
very well.
Yeah. Good evening. Very good evening to Chiradeep. And a very good evening to all of you who are participating in this workshop. I have been listening to Chiradeep since the beginning of this workshop. So I congratulate you, to coming up with this kind of discussion. And I'm sure that most of us and most of the participants in this workshop, maybe they might be having certain issues. They may not be having certain issues. Just they want to know what is the stigmas of the mental issues, or maybe they might be having one or the other persons in their family who have been having any of the mental issues. So very importantly, there are 2-3 questions which were asked by Chiradeep. So it might be a bit difficult for us to explain in detail in each of them. But as he told, he has given lenience to us to put together and answer. So maybe a few things I will be answering, and maybe after me, my wife will be answering a few things. So since the beginning of your workshop, you have been telling that you had certain, mental stigmas, you suffered some of the mental things for past few years. And you told repeatedly that you are able to come out of that because you had a good family, because you had good friends, so they supported you, and because of that, you came out of the problem. So this is very important thing, because when we have any mental issues, we go to the counselors, we go to the psychiatrist, we go to psychologists, we take their support. It might be in terms of medicines, it might be in terms of counseling, but we are exposed to them only for a little while, so we don't stay with them for long. But when it comes to family, so we are the one who stays with the persons who have been affected mentally. It's very easy that family members won't help the people who are mentally affected. When you see a person who has been mentally affected every day, it's very difficult to go through that situation. Though whether it might be our own sons, our own children, it might be our parents, it might be our siblings. But when you are exposed to them again and again, again and again, unless you don't have a lot of patience, it's very difficult to manage them. It's very difficult to go along with them. So now the one thing which is very important in managing these people is having the empathy. That is very, very important. So, though it is very, very difficult, as I told, it is very easy that we blame people that family members are not able to, they are not, supporting. It's very difficult. So that is the thing we have to understand, and we need to learn how to cope up with the people who have some mental issues. That is number one. Number two is, mental issues. It's not a very easy thing like any physical disease. You have diabetes. It's very, very easy how to manage the diabetes. But mental issues are very, very complicated. They are very deep rooted, and yeah, so much of research has been done. Even now, we don't know and we don't understand many of the mental diseases. As you said, many of the problems are not revealed by the patient itself. Like we get many of the patients for counseling and all these things. It's very, very difficult to you know uh, make them to reveal the problems what they have. So the education about the disease what a family member has is very, very important. So if suppose our kids have some family issues, so you need to be having a good education about that. So only if you have a good education, only you have a solid background about that problem. So then it's very easy to tackle the person who is with you, who has been having the mental issues. So these two things are, according to me, apart from all other things, apart from the medications, counseling, and all these things. So these two things are very, very important. If we have a person who has mental imbalance or mentally challenged person, or maybe simple things, mentally challenged, it need not be a very serious problem. Even a person who has a simple anxiety and depression. So if you have any of them, so you need to be educated about that problem, number one. And number two, you need to have utmost, patience to deal with them with the empathy. So these are all the two things I would like to, bring to your mind. If you have these two things, I think lest all other things can be taken care, and we can assure our persons who has been having the mentally, they have some problems. So we can assure them that they feel comfortable, and we will help them to come out of the problem. I think remaining, Dr. Samira will be speaking.
I would like to add to this. Number one is awareness about the condition to the family members. That is very important. And number two is willingness of that person to get out of the problem. So like, for example, I always say to my clients, if your hand is broken, let us suppose that your hand is broken, you just mechanically go to an orthopedic surgeon, You just hand over your hand like this. So he will say that, okay, surgery has to be done. Surgery is done. It's done, finished. You are cured again. Then he'll ask you to follow up with the physiotherapy and medication is given, finished. But mental health is not like how you treat the body. Till now, scientists could not locate where the mind is there. Mind is there, but where is it? Unfortunately, many of the people doesn't understand that mind is different from the brain. Family members think that it is brain related issue. So they take to the psychiatrist without going to the psychotherapist. See, initially we need to take him to the psychotherapist so that the problem is solved. Psychiatry is a entirely different department, but we have seen in our practice, many parents without awareness, they directly take them to the psychiatrist. See, psychiatrist gives the patient a medicine that is a chemical. The chemical will act on your brain. Chemical will not act on your mind. Understand this. Mind is entirely different. So here comes the picture and the importance of empathy, counseling, understanding, and awareness. So when we put all these things together, as he asked second and third question, like if a parent has a child who has a problem, we cannot also expect the entire society to understand our children, right? We cannot, because it becomes difficult for the parents itself to understand the condition, to become aware of that particular condition, at what time, how he will behave. They are unaware of that. So here comes the helping groups. There are so many societies and groups, as Mr. Patra mentioned, in Western society, they have different societies. So some of the names we did not even hear in India, but we have a lot of associations, societies, and groups in Western countries where all such people will go there and they get support. So here, parents also will get educated about the problem. Parents will also get that mastermind sessions with the other parents who have successfully dealt with a particular issue of the child. That is very important. That is very important. So this is really enlightening. We need to, when answering the third question, we need to actually, see, we cannot change the law. It's not so easy, but we can definitely, as an association, we can bring up this from the society. It's like we all need to be educated. We all need to be educated from the base, from the school level, from the college level, so that if in our school, among 400 children, even one child is a little bit different, all the 399 students should be able to deal or understand, converse with that particular person in a very normal way, making sure that that person, that one single individual, should feel that he is quite normal. But we are in a society where everybody looks at that particular child or that particular family itself, in fact, in a very different way, that, "Arey bhai, isko to kya ho gaya?" So, kuch, it's like as an infectious disease. So, no, we need to bring up the awareness from the root levels. And the other day I was reading one magazine where it showed that there is one school in India, I guess it is in Delhi. So they started, why should we differentiate between good children, normal children, and some kind of, children having these issues? So then the founder of the school, he said, no, why should we send these children to separate special schools? We will bring the children to our school. So they particularly started admitting the students to that particular school purposefully, so that they can actually educate other children empathy, understanding, love, affection, helping hand. So then now the school has become so very well that it is having 45 children, and it is beautiful school. It was in, I guess, in BBC News. I saw that and I was really very happy. So if every school becomes like that, every college becomes like that, every working space for adults also becomes like that, then it's a beautiful society to live with. And that's what I can say is, we all say beautiful, let us make this world a beautiful place to live for now and ever. So that's how I think we all need to work on that level. So it's rather than blaming others why they are behaving like this. So we cannot expect everyone to behave with our children the way we want, or that compassionate feeling and other things. I think these are the things we should bring up from the root levels. And also to add on to this, as Mr. Patra said, there are no books which actually give special knowledge about mental health.
Yeah.
But I can really proudly say, as being a yoga professional, in yoga, we study for 5.5 years and we become doctors of yoga, where mental health is given a big space. So we speak about Ashtanga yoga, we speak about the entire yoga. The entire yoga is actually how to manage the mind. The one simple sentence, if I say, what is yoga? If somebody asks, how to manage the mind, which is given 5,000 years back. So what we do in our practice, whoever comes with these issues, I take them personal meditation classes, which is helping them a lot. It is helping them because it's family members is different. Even they also have the willingness to come out of that particular condition. So this is helping them to come out of that particular condition. It is building confidence in them. It is creating hope in them, which is we are finding is really very good as an associative, technique to heal along with our counseling. Yeah.
Thank you so much. Thank you so much.
Yeah, Chiradev, to conclude,
Yeah.
as Dr. Samira was telling, so if you want to manage mental conditions, if you want to come out of the mental conditions, if you want to preserve the mental health, so there are three things are needed. So number one is, as she said, meditation. Meditation is needed both for the patient as well as the persons who are living with them. Because unless you are not relaxed, you don't know how to tackle the patients, is very difficult. And obviously, when there is a one person who is suffering with the mental issues there in a family, all other family members are affected mentally. So, meditation will help the patient as well as the people who are living with them. It will help a lot, number one. Meditation is very important. Along with that, medication also is very important. So there are certain things where initially, to manage the mind, to manage the violent conditions, to manage the physical symptoms. So medications are very, very important. And with this, you also need to have the counseling where there is an intervention in your lifestyle, where we counsel about different aspects of the lifestyle. So counseling, meditation, and medications. If these three things are there, I think we can manage the mental issues very easily.
Yeah, and also during the counseling, it's very important to go to the root level to find out why this has caused. Actually, when we keep asking the questions, the client itself comes up with one particular situation which has triggered this particular condition in him, maybe 5 years ago, 10 years ago, or 15 years ago. So if we can solve or heal that particular thing, then most of the patients are getting recovered very well and very nice progression.
The existential thing and the past thing, if while taking the history, it will be easier for it's easy to understand the problem, the cause. Yeah, thank you so much. Thank you so much. Now the floor is open. We are already late and now we will close. If anyone has any questions, so I just wanted to share that as Dr. Sukma said, meditation, medication, and counseling. So my meditation was, what was my meditation? I meditated on God's word and prayer. I was filled with the knowledge of God so that nothing goes here and there. And the comfort and the counseling, the warmth of my family. Probably those things worked like CBT, cognitive behavioral therapy, in my life. And myself, Samira knows how everything I take it to God, pray. When you focus from yourself to God, the creator of this world, I mean, if you meditate on him, the life changes. Okay. Thank you so much, doctors. So, the floor is open
Also,
to you.
I would like to add one point here.
Yeah.
See, what happens when you focus on God? That means we are believing and we are trusting the universal power. There is some power which is controlling everything. When you believe in that, then you feel that I am not everything. When you feel I
Yeah.
am not everything, whatever is happening to me is for a purpose. So then the pain comes down.
Yeah.
So that is the logic behind. So when you feel that maybe I am suffering today, that means I am in a position now so that I will be able to help thousands of other people who are suffering with the same problem. That's why in coaching today worldwide, the
Yeah.
pain point is becoming the solution
Yeah.
for others. So that's why asking questions or sharing your
Yeah.
experience
That's
also was actually
that is
the
right.
same purpose. Yeah.
Anybody has any questions? I know we discussed so many things. I think everybody understood everything.
Yeah.
If you have any questions, many people have left losing their surprise gift.
How to make a person agree to go for a counseling or treatment?
That's the most difficult question. You know, somebody I told and he said, "Am I mad?" So I don't have any answer to that question.
I have answer. Chiradip.
Yeah, please.
I have answer. So just I was going through the same topic. So very nearer to our question. So one of the problem we face with the people who are mentally ill or mentally challenged, very often they disagree to take the medications. They disagree to take the medications. So the easiest way to make them agree is that you should explain them that what problem you have. You have a diabetes, you have high blood pressure, you have maybe some cardiac issues
Thyroid.
or thyroid, whatever it is, and you have been taking the medications. And because of you are taking the medications, you are able to lead a normal life. So you explain him that you have this problem, so that's why you are taking the medications. And because of the medication or because of some changes in your life, you are leading a normal life. And also you explain him that what happens to you if you don't do that. If you don't take medication, what will happen to your high blood pressure? If you don't take something else, what will happen to your disease? So what is the outcome of that one? So you're explaining them both the good thing and what will happen if you don't take that one. In the same way, you should tell him that his problems also will be solved if you take the medication. Your problems also will be solved if you take the counselings. So when he understands that, yes, when they can be healthy by taking medication or maybe taking making some changes in the lifestyle. So he will say to yourself that yes, I should go for medication. So I should go for the counseling or I should go to the doctors. So I think slowly they will try to understand. So that's how we should motivate them.
And also, when any clients come to us with diabetes or hypertension, we give them lifestyle modifications. Like these foods are good for you. These foods kindly avoid or reduce. So these kind of changes. So similarly, so we can also encourage them that counseling doesn't mean that getting acknowledged that you have a problem. Counseling is something that maybe sometimes you find that you are doing everything right. So whatever decisions you are taking, or maybe you are having some problem, maybe sometimes whatever the problem I have, I may not be getting the solution. But when I ask the same problem, he might be able to give a very quick and instant solution for my problem. So many times it happens. So similarly, sometimes constantly the client, I mean the patient and the people in the home may not be able to figure out how to deal with. But if we go, he is an expert, So he will just talk to us and he will give us solutions to find a better way to come out of this. So in this way, so basically we have to understand, and timing of conversation with them also is very important. So they cannot, we have to look at their mood. How is their mood? So how is the situation? What is the timing? So then coolly say.
So one of our client was asking like how to convince them. So if you convince them when they are, when they are very bad mood, when they are, completely irritated, of course, for lifetime, they won't take the medications and they won't go to the, counseling. So as Dr. Samira is telling, the timing of convincing them is very, very important. See their mood, see their mental, status. Are they relaxed? So, you can feel everything. So when you, at that time, if you, tell them about the medications, counseling, and all these things about the treatments, so I think they will abide and they will go on.
And it's like how you deal with your children at home. So children will be very adamant at certain things. But when they are misbehaving, when we keep insisting them to do a particular thing disciplinedly, they will not. So then they will be shouting, we will be shouting, the whole environment will change. So lunch ho gaya, dinner ho gaya. Your father has got your favorite chocolate or ice cream. Then when we are all sitting together as a family, enjoying that family time, then we can simply ask, Dekho beta, why did you behave that way that day? So instead of that, it could have been done like this, isn't it? So then the child's response also will be entirely different. Similarly, here also in our client's response, there will be a drastic change. So look at the time, at what time you are supposed to speak, his mood, there will be mood swings as well. So when is he patient enough to listen? So that is very important. And you cannot expect that particular family member to understand whatever you are saying at a go, at a stretch. So just give them pause, let them understand in their own pace and then respond. So sometimes kya hota hai ki we are normal, we feel that, there's a same thing I have been telling several times, but you are not understanding. So instead, we have to come down to their level and we have to understand and make them understand.
Any other questions from anyone else?
Hiradaipo, you should see their chat box. There are some people asking their question in the chat box.
Yeah, I saw.
So I think if you are able to see, you can come up with those things. So we will be able to answer them.
There are different kinds of. It's not pertaining to this particular subject. So
Yeah.
I'll just and whatever you have answered, we have already. Ma'am has asked this question, so I think we have addressed it. Any other question from anyone else, or else we will close?
Hi, Brother Chiradev. So today's session was really very nice. Actually, as you told in the session, in India, mental problem is not taken seriously, and particularly as you know that in ministry, people, what they think is when they face a mental issue of others, they are willing to help. So I would like to share one small experience with you. There is one lady, and she had a relative who was mentally, she had a lot of issues and she had to be admitted in mental hospital, and she did a lot of helping to her. But now her own daughter is facing issue. But what she is telling now is no, she is spirit possessed, just like as you told at the initial session. And what she is saying is even when I'm praying, the spirit is attacking her. So in spite of explaining again and again, she is not understanding. So how to handle such people?
Yeah, it's a very, very
Different level.
difficult questions to answer also.
Can you, sister, I could not hear you properly. Can you just repeat the question once more?
Okay, brother, no problem.
Yeah.
Can you hear me now?
Yeah. I can hear you.
Okay. There is one lady who is coming to a church, brother, and she is in her 50s. So she had one of her relative, and she is also a lady. She was in mid 30s, and she had a lot of mental disturbance, and she had almost, we can say that it was a kind of mental retardation, and she has to be admitted in mental hospital. And she helped that lady in whatever way she could. But now what the issue is, our own daughter, she's a well-educated girl actually. She's in her mid-20s. She's finished her MTech, and now she's having lot of mental issues. But this lady is not ready to accept that she should go to a psychiatric or a counseling session is needed for her daughter. What she's saying is, I am coming to church, I am praying. No, that is why evil spirit is attacking my daughter. So as you know that even I am from psychological background, even when we try to explain to her, no, it's better that you should take her to a professional, she's not ready to accept it. Sometimes they understands other problems as mental issues, but when it comes to their own family member, someone whom they love very much, they are not ready to accept it, and that is why the problem becomes very severe. And so how to deal with such people?
Yeah, see, it's literally difficult because we faced the same condition during the corona. So during the corona, one of the family, they were all affected. Their mother was affected. So then, their children were also having symptoms of corona.
Okay.
You won't believe they did not go to any hospital. They did not get any help online. They said, God is helping us. God will help us get through this problem. They did not even take any precautions or any medications that government was supplying during those first, lockdown session. And eventually mother died. After the mother died also, the children could not change their attitude. They said, no, mother is gone because of her, whatever. So no, we will not go to any hospital. We will not come out of the house, and God will come and help. So this, to a certain extent, is kind of, I can say, I don't say lack of awareness, but it's a kind of not even overconfidence on the God, but there are few aspects where we need medical aid. There are few aspects where we need to have faith. So when we exchange these two things, then it becomes pathetic. So rather, we should combine. And also it is important that, especially when we come across with such people, it's all kind of illusions and hallucinations what we have about our own self, and insisting or just rubbing those beliefs on our children. So it's basically we are ruining their personal life. So that's why individual personality development is also very important in tackling such issues which come from other family members. So anything would you like to
I
ask
just
about?
wanted to address this question because say I trust God fully. Okay, as I said, my meditation was fully on God and His word. Okay, so God has given us knowledge and wisdom to apply it. Okay, if God will definitely help you. Okay, you can have full trust and confidence on Him, but He won't do what you can do. He will do what you cannot do. Did you understand my point? He will do what you cannot do, but He won't do what you can do. He's not your servant, He's God. So when God has given you wisdom, it is good for you to apply it. Doctors are there, and psychotherapists are there, and we human, He has created this supportive. When He created as a unit. Okay, He did not create as loners. jao ab akela akela khelo. Nahi, he did not created like that. He created communities. He created husband and wife. He created the people so that they can live together. They can support each other. And if we are not supporting each other, we are going against God. So, sister, if you meet them, those who are out of convenience, simply blame God, that God will heal. Yeah, God will definitely heal. No doubt about it. Okay? God will definitely heal. But you need to do what you are supposed to do. You cannot just take and wash your hands out of your responsibility as a mother, as a daughter, as a sister, or whoever it is, family members, and just blame it on God, leave it on God. You have to do whatever you could do. So, Sister Jemima, you have to intervene. What the church members are doing, they have to go and address. They have to go and intervene. They have to go and scold people. I know family matters, it's difficult to do that, but you don't scared about being having a strained relationship, but you have to go and tell. If you know something is wrong, you go and tell. Yeah, that is how, as Samira said, Dr. Samira said, that we were all created for a purpose, and doctors are created for a purpose. If God, if we don't apply, then doctors are useless fellows. Did so much work, hard work, paid so much money, and so I'm not disqualifying God's. I can't do that. Being a follower of God,
There is also one simple analogy to what you are saying. Like when we do agriculture, what is man's responsibility is to look for the land, make it ready, then cultivate it, look for we choose the very efficient seeds which can grow very well quality, good quality seeds, sow it, and when he has to water, when is the manure to be applied, manure. So, but still he will wait for some magic to happen from the God, then only with the will of the God, the crop comes in. Okay, but he need to do the groundwork, right?
Yes,
so
absolutely.
Without God cannot just give you a sanction.
That's a very nice analogy. So you have to do your part. You have to do your part. He won't just he can do out of nothing. He only created everything. That's fine. But after he created, he has put humans to take care of this world, to take care of each other. That's called stewardship. So being a good steward, we have to take each other's, help each other, support each other. So that's what I can answer. Any other questions? Or else we will close. It's already very late.
Yeah.
Gone past 9:30.
So, hello.
Yeah, Avinash.
Yeah, to the previous discussion, I just want to add from my personal experience, my personal story.
Yeah.
So, like when I was in high school, I fell down, I fell back, and for which I got head injury, and I lost my memory for almost 3 hours, more than 3 hours. I was unable to identify my parents. It was till today I call it the blackout hours for me. I do not know what all happened, but I was behaving like a mentally retarded kid, and that's what my state was. And without like my parents brought me back home, and they had no option, so they prayed. They just prayed for me, and suddenly after 3 hours, I was able to get back to my memory, and I was able to identify everyone. But I had severe headache. It means I was unable to rise up from my bed. It was that condition. And later on, when my parents took me to the doctor, I still remember in Cuttack SCB Medical, he is a neurosurgeon. Then he was a neurosurgeon. His name is Dr. M.M. Dheer. So when he saw, he said, "Who actually? What happened to your kid?" Then my mom explained all the story. Then he said, "But your son looks, he is in a better condition. In medical science, we have only three response to such a person: either spot death, or completely he will be in a coma stage, or a mentally retired person, and the glimpse of which you got in those 3 hours. So we do not have any medicine or anything to recover such a person from such a condition. Better you, I am just giving some painkillers so that your kid will find it comfortable." And they gave me, and I had those medicine, and slowly I started, that pain went away. But the same doctor, in their CT scan report, I still have those reports. They said till next 15 years, he cannot study, he cannot travel, he can't do anything. Even uh, you keep him only in a dark room. Even the sunlight should not fall upon him. It was that severe condition. But I must thank the Lord Almighty that He gave me strength, and with the faith in God, I went, I studied, I continued my study, I did everything. I never had a problem. So it's the balance of everything. God did what God has to do. He healed me. And the same time, when it comes the physical pain, getting rid of physical pain, my mom went to the doctor, took me to the doctor, and I took those medicines, and I find relief. So it's the balance of two things. And as Dr. Samira made it so nicely with the agriculture part, so we should never stick only to the faith, but it's a balance of things. Even the doctors are gifted with those knowledge by God. We need to consider. We cannot just ignore that they are they can't do anything. So I should give that note to it from my experience.
Okay. Over to Christine.
I'm sure all of you will agree with me when I say that this webinar has indeed served as an eye-opener for us all. Thank you, Mr. Chiridipatra, Dr. Sukumaran, Dr. Samira, and all our participants for being part of this impactful webinar. Let's carry the knowledge, insights, and empathy we gained today into our communities, workplaces, and daily lives. Together, we can break the chains of mental health stigmas and build a more inclusive and compassionate society. Remember, this is just the beginning of our journey. Stay connected for future events and resources to continue this vital conversation. As promised from the beginning of this webinar, I hope all of you remember that, Mr. Patra has shared a link in the chat box. Click it and you will have a few printable posters, infographics, and cheat sheets on mental health. For further updates on future webinars and personal counseling and motivation, do follow Mr. Patra on Instagram. The details have been provided by him on the chat box. At the end of it, you will all be prompted by an email and WhatsApp message to leave your valuable feedback about the webinar today and about Mr. Patra's life coach profile. Do rate him and leave your feedback positively. Before we close, Mr. Chiridip has something to share with all of you.
Yeah, the session is closed now. So I am stopped. I'm switching off the recording button.